Chairman Murphy, Ranking Member DeGette, members of the committee. My name is Josh Archambault, and I work at the Foundation for Government Accountability, a think tank that is active in 37 states, specializing in health and welfare reform. This morning, I'd like to highlight how the ACA's Medicaid expansion has worsened problems for the truly needy, and I'd like to start with a video.
The mother of a 10-year-old girl fears her daughter won't live long enough to receive the assistance she's been waiting on for nearly her entire life. She's one of thousands on a waiting list that state leaders are looking for ways to trim. Tonight, 7 on Your Side's Jason Peterson shares some ideas. Jason.
A year ago, Skylar Overman was given a month to live. The grim prognosis followed a life racked by a rare neurological condition, schizencephaly. She has multiple seizures a day. She requires constant care. Thankfully, she has a mom who's up to the job.
I give her medicine at 8:45, and I'm in bed not too long after her. It's just, people don't realize how much care that these kids need, but they also don't understand how worth it is. Taking care of her and having her in my life has been the best part of my life.
Parents like Lindsay can't just call a babysitter, and specialized care is expensive. A Medicaid waiver would help pay for that. Over 4,000 Arkansas families have one. Nearly 3,000 families, including the Overmans, are waiting for one. And it's a long wait.
She's still 670s, so she's moved less than 10 spots in 9 years.
That's the sad fact, is that at the rate it's going, there are people that will die before they get to receive their services.
Sadly, Skylar's story represents just one of nearly 600,000 individuals currently sitting on waiting lists for Medicaid services. Individuals with developmental disabilities, traumatic brain injuries, and mental health disorders who are less likely to receive the needed care now that Medicaid has been expanded. The ACA expanded Medicaid to a brand new population, which consists largely of childless, able-bodied adults who are working age, and have only dimmed the hopes further for families like Skylar. But the problems go much farther beyond situations like hers. The governor of Arkansas, due to expansion costs, has proposed nearly $1 billion in cuts to traditional Medicaid, primarily from patients with expensive medical needs, the developmentally disabled, and the mentally ill, as what he said. So why is this happening around the country? The new Obamacare expansion population is awarded a higher match rate. This funding formula has pernicious unintended consequences. Let me explain it this way. If a state needs to balance its budget, which they all do need to every year, state officials have to turn to Medicaid because it's the biggest line item. It's also growing faster than revenue. If you want to save one state dollar in state funds, on average, you need to cut just over $2 from the traditional Medicaid population. The aged, the blind, the disabled, pregnant women and children. But if they want to save that same $1 in state funds for the expansion population, this year they need to cut $20. I know you all can guess who faces cuts first, and it's heartbreaking. Over-enrollment under Obamacare's Medicaid expansion will encourage states into even deeper cuts. Data from 24 of the expansion states show that enrollment has been over by 110% on average, more than double initial estimates. The cost overruns have been significant. Just to name a few, California found themselves 222% over budget. Ohio, $4.7 billion, or 87% over budget. These enrollment and budget trends mean fewer resources for the truly needy. Now, history could have warned us of this. Arizona and Maine both expanded Medicaid to the same able-bodied childless adult population before the ACA, and both had to take measures to rein in costs. Arizona had to stop a number of organ transplants. Maine capped enrollment, created wait lists. This happened even without the lopsided extra funds that follow expansion enrollees. Which brings me to my last point, concerns over eligibility issues. FGA's work around the country has found deep systemic problems. First, states need to be checking eligibility far more frequently. And second, states need to be checking more data when they check eligibility. Life changes such as moving out of state, getting a raise, or death are going unnoticed for far too long. And meanwhile, states continue to cut checks to managed care companies for cases that no longer qualify for the program. My written testimony highlights a couple of those states that have had bipartisan success in tackling this waste and fraud, but much more is needed. Thank you.